One of the most misunderstood and improperly described conditions that we know of as Americans is autoimmune disorders. And the issue with that is that people are treating a lot of different symptoms that are actually causes of autoimmune issues, and they're never actually getting to the source of that particular issue. And we have a really, really good example that we're going to go through with you today. Hello, my name is Dr. Brandon Bupp. I'm the owner of the Advanced Health Wellness Center, and this is Leah Clyde. She is our physician assistant specializing in functional medicine and non-surgical orthopedics. And if you haven't watched our channel before, we have wellness center, an integrated wellness center. Really, the goal is to help people have a better quality of life because they have better health. And what that means is we have to dig deep and find out what might be causing people to not be living the life that they are really designed to live. What is causing the energy to be pulled out of their system? What is causing problems to keep resurfacing? And what is causing us to have to continue to treat symptoms constantly? So our job is to figure out where these issues may be coming from and then how we can make positive changes with our patients. And so today, what we're going to do is talk about autoimmune issues, which is very overlooked, very misunderstood, not well explained. So one of the big ones is thyroid autoimmunity, which is typically referred to as Hashimotos. So if you're not familiar with Hashimotos, Leah's going to explain that. And then there's another one with the thyroid that is called Graves' disease. So many people have heard of Graves' disease, which is actually less common than Hashimoto's, but maybe it's more commonly heard. I don't know. Anyway, Leah, could you tell us a little bit about that?
Yeah, so thyroid, there's a few different ways that you can have an autoimmunity of the thyroid. Autoimmune, in general or by definition, if you don't know, is basically that the body is identifying healthy cells as unhealthy or as invader cells, and the body is performing its defense mechanism on those cells. So basically your body can be attacking your own thyroid because it's identifying it as abnormal cells. So Hashimoto's would refer to what the two antibodies that would be producing an underactive potential thyroid disorder.
So thyroid problems can actually be not even just that the thyroid is an issue, but that it's because the body is attacking the thyroid cells.
Definitely. And it's more common than anybody thinks because we don't test antibodies, PCPs, doctors don't test antibodies as a basic physical check. So while you may get a couple of the thyroid markers, they might be normal, but you still have these symptoms going on, symptoms that would include weight gain, low energy, trouble sleeping, hormone changes, hair loss, joint pain, inflammation, digestive issues, could all describe what Hashimoto's would look like. Now, your thyroid it knows what it's supposed to do. Your brain communicates to it. It produces thyroid hormone. Your gut and liver help convert it over for your body to use it. Now, if your body identifies the tissue as unhealthy or abnormal, the attack process, the autoimmune process starts. It can take a long time for the body to be attacking your thyroid, essentially, before the thyroid actually shows up as not working on your blood work. So it's something that could be worked on from a functional medicine standpoint long before your thyroid's actually underactive. And I think that understood maybe or described very frequently, but that's something that we look for. So the antibodies that would be Hashimoto's disease technically are just a basic part of our blood panel because we know that we can start working on that before the thyroid maybe is a problem.
And actually, there was research that showed 90% of people with hypothyroid issues actually had Hashimoto's.
Oh, yeah.
And it was very misunderstood, misdiagnosed. So is that an immune system issue or is that a cell issue?
Well, cell issue.
Correct. So that's, again, something that is many times misunderstood. Your immune system is not attacking what it sees as healthy cells. So it's like they go, well, your immune system is bad. No. That's typically not the case. It's not the immune system. It's that your immune system is actually attacking something that it believes to be foreign because there's some disruption with the cellular making process. So, man, that's like mind blowing in case that didn't just happen to you while you were watching this. But that's a big deal. And so the healthier the cells, the less autoimmune issues people are going to have. Okay, so the other one being Graves' disease.
Yeah, Graves' disease is usually the opposite. It would correlate more with the hyper or overactive thyroid. It's less common, but I think a lot of people, like you mentioned, have heard of Graves' disease compared to Hashimoto's. So
Right.
we don't see it a ton, but it definitely exists. And unfortunately, medically, the treatment is to do something to make this thyroid stop working. So then you're setting yourself up for a lifetime of underactive thyroid when the thyroid is just kind of a down the line domino effect problem where other things needed corrected to begin with.
Yeah. So then so obviously there's symptoms. We talked about that. What are some other symptoms of autoimmune issues? Like, what are other examples of autoimmune issues? And then also, what are some symptoms of that?
Yeah, there's a lot of different autoimmune stuff that you may or may not have heard of. That there's diagnoses that have names to them. There's just general autoimmunity. I mean, you can have lupus, there's Sjogren's, or scleroderma, or
Psoriatic arthritis.
psoriatic arthritis. Some people believe Crohn's could fall into the autoimmune spectrum. I mean, there's going to be a lot. It's just named based off of the body part or cell or tissue that it's mainly affecting.
Right. That's being affected by the immune system really disrupting.
Mm-hmm.
So how does one know if they have an autoimmune issue?
Via testing, blood work,
Right.
mostly.
So what does that mean?
You'd have to specifically be, looking for autoimmune disease. So that's what is another thing with, if you're hoping that your yearly physical shows up as here's your problem, it probably won't, because they don't check for inflammation or autoimmune diseases regularly on those. It's just not part of the protocol.
What are some general symptoms of autoimmunity?
General symptoms, super commonly fatigue, trouble sleeping, joint pain, digestive issues. I mean, we're going to see those probably across the board. No, again, like fatigue, digestive problems, which could be heartburn, nausea, vomiting, diarrhea, constipation. It doesn't have to be one or the other.
Gassy,
Bloating. Yeah, gassy, bloating. IBS, they could have told you maybe you have IBS. That's usually a sign that something deeper going on. Inflammation or joint pain. So a lot of people feel pain in their joints, chronic pain, and it's not one or two joints. It could be all of them. Maybe you're diagnosed with fibromyalgia. Why do you have fibromyalgia? What's causing all that inflammation? Could be something to dig deeper for.
And something else that is also commonly experienced is that, number one, they've been going through different doctors and vitamins and supplements and things like that, and it just hasn't shown to resolve the situation, is one of the things. And then the other one is that after some sort of a stressful or traumatic event, the problem got worse. So that could be something traumatic. One that's really common is pregnancy, right? So it's like person maybe has some feeling of autoimmune issues, gets pregnant, feels good. And a lot of autoimmune women tell us the best I ever felt when I was pregnant. Mm-hmm. And then they have the baby, stuff a lot of times will really
ramp up. So when you're pregnant, your body is like, I'm going to do everything I possibly can to regulate the growth of this baby. And so some of the other issues or malfunctions sort of take a back seat because growing the baby is like the main focus. Once the baby's out and the hormones try to regulate, the body's like, oh, I have all these issues I left kind of behind and I need to go address those. And there's going to be some cellular abnormalities and then potentially a weaker immune system because of, the trauma of just childbirth and being pregnant. So it can wreak havoc after pregnancy. We hear that a lot.
So we actually have a really great video coming up after this one where we're going to talk about something that can be done to actually help with thyroid problems and autoimmune issues. If you found this information to be helpful, please like it, share it, subscribe to it, send it to a friend or family that's been complaining about some of the things that we've been talking to, or just looking for solutions other than taking steroids or immune suppressive medications or having to do over-the-counter things to manage symptoms. Guys, we know that's no way to live. Again, the goal and the purpose is to maximize and optimize our health so that we can have a better quality of life. And I think that's it. Anything else? All right. We hope to see you soon. If you'd like to do a consultation or have a conversation with us, it's real simple. Click the link, go on the website, schedule. It's adv-health.com. You can schedule the booking link there just to schedule an appointment to meet with either myself or with Leah. Or if you'd like to just have a phone call with us, send us a message and we'll reach out to you, see if there's something that we can do to help. Have a great day.